Hi, this is Dr. Tom Durrell over at SurePoint ER Medical Center on the island. We're here to talk today about beach and waterfront injuries. We see these things all the time. I've been practicing here on the island for over 15 years, and we see these types of injuries come and go on a daily basis. The first one I'd like to talk about are penetrating injuries that we oftentimes see with stingrays, which are very common here on the coast. We also get into trouble sometimes with fish spines and fish barbs, particularly catfish and hardhead spines. These things will act very similar to stingray injuries. Both of these will cause quite a bit of pain and are very common reasons for us to see patients into the emergency room. Typically, when you are looking at these types of injuries, usually it occurs in the surf, somebody that's barefooted. There's thousands of people on our coastal bend visiting our beautiful beaches and water, and it is just a matter of time before the odds are not in your favor, where you end up bumping into one of these guys in the surf. Typically people step on them. The ray, in the instance of stingrays, will flip around defensively and hit you with their barb, usually in the lower part of the leg or foot. Initially it'll feel like a little pinch. Some people think it's just a crab or something, and then a little while later, depending on how much venom gets into you, the serious pain starts. And the pain can be, I would say, only second and third to kidney stones and childbirth naturally. So people get into quite a bit of pain with these and often don't know what to do. So typically what we recommend is we want to recommend submerging the extremity in water that is about as hot as you can stand it without suffering a burn from it, using an antiseptic soap, or potentially betadine or iodine in there if you're not allergic to it. This will usually help with the pain. The pain is not the only thing you have to consider, though, because these wounds typically are bad about getting infected. Sometimes they can injure anatomical structures, and sometimes they can break off pieces of the barb or the entire barb into the wound, usually, like I said, on the extremity, although we've sometimes seen them in the hands, people trying to handle them, or even in surfing. Sometimes we'll see them up in the upper part of the lower leg, thigh area, buttock. I've seen them in there as well. So it's important that you get seen to have imaging to make sure there's no spine left in there. In addition to that, you obviously are going to need to control the pain with cycling the hot antiseptic solution. Sometimes the wound needs to be repaired if it's very large. In addition to that, you're going to need antibiotics to cover the bad types of bacteria that we run into down here in the coastal bend. That would include Vibrio species, which are the flesh-eating bacteria that you hear about, and methicillin-resistant Staph aureus, which makes up about 89% of other community-acquired infections in our area. Typically, all of that stuff can be handled in the emergency room. Usually, our doctors and nurses are very skilled at this. They've all been trained in it and had numerous encounters, so they know how to deal with this. Prevention is a big key. Being aware of your environment, knowing where you're putting your feet, doing the stingray shuffle, which is a local phrase that people use for shuffling their feet, hoping that they are going to scare away a stingray before they actually step down on it. It's not foolproof, but it probably does help some. Wearing boots and shoes, particularly if you're wade fishing, water shoes if you're in the surf. Those are other things that can help some, although many of these spines will go right through some of those wading shoes and boots. So be careful out there. Pay attention to your environment. If you get hit by a ray or even a catfish spine, typically these things are treated the same way as we treat stingrays, and if you're hit with one of them, again, hot water immersion, x-rays, antibiotics, and pain control is the way to go. So keep an eye on your environment, and hopefully you won't run into any of these when you're having fun, and if you do, come see us down here at SurePoint ER. We'll take good care of you. Thanks for tuning in.